So we've done some research. Here we took 15 patients with patellofemoral pain syndrome. 15 might seem like a low number, but they all had unilateral, they had PFPS on one side, they had for a specific amount of time, they'd all failed conservative treatments. And they did these 2 exercises using a piece of TheraBand for 3 weeks. That's it. We didn't even want to offer them a bag of ice. We didn't change anything about their footwear. They didn't stop running. They continued with their current mileage. They did 2 exercises that key on the gluteus medius to strengthen that muscle. In 3 weeks, we had a 50% reduction in pain, and 13 out of 15 subjects were nearly pain-free in that point in time. And they all had about a 30% increase in strength. Most importantly, when we looked at the data, this is what their footfalls, so think of each of those red lines as being one footfall, then the next footfall, and the next footfall. Before treatment, they had a very unpredictable foot strike pattern. And after treatment, it's very predictable. So what's happening is, when the muscle is weak, you are unable to stabilize your knee, stabilize your hip in space. So your foot strikes, and your knee might collapse slightly outwards and then inwards. And the next footfall, it might be held stable. The next footfall, it's going to collapse way too far inwards. It's an unpredictable footfall pattern. You can get direct treatment for your knee, and I'm sure that's somewhat beneficial, but 75% of people have reoccurring knee pain. So my job as a researcher is to come up with innovative health tools to try to reduce that. And those 75% of people go on to develop osteoarthritis, unfortunately. A large percentage do. So we're trying to prevent osteoarthritis, promote healthy aging. So what we've done is based on the premise that by strengthening muscles, we're providing the body with a predictable foot strike pattern to allow tissue healing. We've developed the gait analysis system. So if you wanted to get a 3-dimensional gait analysis, there's a lot of places that offer a 2-dimensional analysis. They have 1, maybe 2 cameras. They have software like Dartfish, for example, and that's pretty reasonable, but it's quite inaccurate. Our research has shown that. Research from 1990 has shown that. So based on our technology, you can come to the University of Calgary and get a 3D gait analysis. You can go to Stanford, University of Delaware, or Florida. That's about it. There's not any commercially available products out there where you as a runner can go to. So we developed a 3D gait analysis system where essentially what we're doing is we're turning you into this 3-dimensional stick figure. So this is your pelvis. Let me see if I can get this to play again. So there's your pelvis. You got both thighs. We're going to rotate it here in a second. Your feet and your shanks, or your lower leg. So what we're doing is turning you into a 3-dimensional stick figure. With millimeter accuracy, we're able to calculate the joint angles and figure out what's going wrong. We compare you to our database, which has thousands of runners in it, in order to understand what's typical and atypical motion. So from this, we've been able to actually get it into clinics and get it available for people to use, for runners to use. More importantly, we've been able to do some really cool research. So here's that same data that we just looked at in terms of variability of movement, just looked at it in a bit of a different manner. So this is a 3-dimensional overview of a hip in space in 3 dimensions. This is the injured side, and you can see it's a large footprint. That hip is not being controlled. And each of those lines is an individual footfall, just somebody running on the treadmill. Whereas on the non-injured side, it's a much smaller footprint, if you will. So this person can control the injured side, they can't control the uninjured side. And this is only 25 footfalls. Multiply this by 20,000 per side, you're setting yourself up for an injury. And after the muscles get stronger, this footprint is much reduced. So we've advanced the technology significantly in the time that we've been there. And we've been able to develop just a simple tool to help you understand what's your injury risk. So you want these numbers to be as close to 100%. This is based on a percentile rank. You know, everyone's always striving for excellence. So in this situation, this person has knee pain. It has nothing to do with their ankle. That's a good score. They're in the 84th percentile in terms of ankle mechanics. Their knee is not doing great. Functionally, they're running just fine. And the hip has, so between the hip and the knee, they have 64% flexibility in their system. In other words, if this person commits a training error, they still have opportunity to adapt to that training error. But if they're mechanically unsound, if they have a lot of variability of movement, for example, that index score drops. Maybe it drops to 40%. You only have 40% flexibility in your system. So in a very scientific, reliable, and valid manner, we've come up with a method for determining what's your index, how much flexibility do you have, and that is to guide you, or guide the clinician to figure out what do you need to do, where do you need to strengthen, where do you need to get stronger. So we've actually been working on some other, I think this is the coolest research we've done yet. We developed an artificial intelligence. I just have a ridiculously smart PhD student working in my lab right now. So we input all of the variables that we collect from our data analysis system. And based on the data, we're able to come up with a barrier that separates as best we can and optimizes separation between the red people who are injured and the blue people who are non-injured. So we have 95% accuracy. If you come to the lab, we can actually tell you with 95% accuracy, are you going to get injured or are you injured, even if you don't say anything to us. More importantly, see that blue person right there? They're about to get injured. They lie on that injury side of the plane. Most importantly, that red person right there, they will not succeed with traditional therapy. This is not a musculoskeletal or a biomechanical problem. This person needs to be referred for an MRI, neurological testing. Maybe they're on the verge of some type of osteoarthritis or some type of cellular change that's going on. But this is somebody that we would refer immediately out. We could tell them, you're not going to respond well with physiotherapy or with chiropractic treatment. There's something else going on based on our data. So this is where we're moving to at this point in time. But we need a lot more data. I think we have, this is a pretty large data set. 20 or 30 per group. We have hundreds in our database right now that we'll be pumping through and trying to improve our software to basically, my job is to come up with innovative health solutions. I'm funded by Alberta Innovates or the Alberta Heritage Foundation, but this is where we're going with what we're doing. So we've been successful in taking our 3D systems to downtown Calgary, to Banff. We recently installed, as of 2 days ago, at Parkway Physiotherapy in Langford, just outside of Victoria here. If you want to hear more about what we're doing, we're in booth 21 right there as well. But what I get excited about is that we receive data from all of these affiliates who have our systems in place, and that allows us the power to do better clinical research. And it provides you with the opportunity. You don't have to go to Stanford, Calgary, Delaware, or Florida to get this sophisticated analysis done. You can just drive down the road. Or if you live in Calgary, you can go to downtown Calgary if you want. So we are trying to expand this in order to expand our research. More importantly, provide an innovative health solution for runners based on our research and other people's research as well. So, to summarize, based on our research and research from other labs, hip strength is a key factor in the prevention and treatment of running injuries. I hope by showing you even just that little bit of data, I've somewhat convinced you. 2 simple exercises. And if you want those exercises, just go to our website. Everything that we do is posted online. If you can't find it online, you send me an email and I'll send it to you as well. 2 simple exercises can help to restore proper hip and knee mechanics. And it's something that we promote as an injury prevention tool. One thing that we're particularly proud of, we work with the Honolulu Marathon Group at the University of Calgary. Those are first-time marathoners. We have a 98% success rate getting them to the line for their first marathon. Now there's a lot of factors. It's an 8-month training program as opposed to a 4-month training program. But day number 1, everybody starts our exercises. Unfortunately, they call them the Ferbers, which is my name. Like, have you done your Ferbers today? Somebody might complain about pain in the knee. Have you done your Ferbers yet? And I don't really appreciate that name. I don't like that name very much. But 2 simple exercises. We have 98% success, and we've had 98% success for the last 6 years that we've been working with that group. You should find diminished pain within 3 weeks. This is a hard number, and I say to every single patient, if you're not finding significant resolution of your symptoms within 3 weeks, you have 2 choices. Your therapist comes up with a different hypothesis of how to treat you, or you find a different therapist. But these simple exercises should be incorporated because weakness and pain, we're trying to tease this out, influences movement variability. It's not how far you move, it's how variable your movement patterns are. So there's a lot of, we're primarily sponsored by Alberta Innovates or the Alberta Heritage Foundation. Certainly, yeah, a lot of research foundations that have supported our research at the university. It's all peer-reviewed. So I always like to thank them, and I'll thank you for your time and attention. I'm happy to answer any questions.